and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today we're going to be discussing a subject that's near and dear to all of our hearts, and that is achieving and maintaining a healthy weight. As a primary care physician, I spend a tremendous amount of time discussing this very subject. And when I do, I always like to frame it with a story about a patient of mine. This particular gentleman has long suffered from a weight problem, and he also has a diabetes problem and a heart problem that are directly a consequence of his weight. So you can imagine that I've been trying to get him to lose weight for many years unsuccessfully. So one day he walks into the office for his appointment, and he's lost 50 pounds. Of course, I get up, give him a fist pump, and congratulate him on his weight loss, tell him how good he looks, and he proceeds to tell me how good he feels. And I have to ask him, how did you lose all this weight? What motivated you to lose all this weight finally? And he said, oh, it has nothing to do with my sugar control or my heart problem. My daughter just got married, and I wanted to look good walking her down the aisle. I think this story is very telling, and what it tells me is that people are motivated to lose weight because they want to look better and they want to feel better. And those are great reasons to lose weight. But there are health outcomes as well. And as a physician, I just wanted to remind you of a couple of those. The reasons to lose weight, as you can see here in this slide, I mentioned people want to look better and they want to feel better. They also want to live longer. There is a linear relationship between weight and longevity. What does that mean? It means that if you are thinner, you are going to live longer. As far as other improvements in health outcomes, these are the ones I like to focus on as a physician. There are many, many. This particular slide here, you can see that weight loss causes your blood sugar to be lower. It causes your cholesterol to go down. It lowers your blood pressure. I think most people would realize that. They also are probably aware that weight loss results in fewer adverse cardiac outcomes, such as heart attacks, stent placements, and bypass procedures. But there are some other health outcomes that you might not be readily aware of. For instance, weight loss slows the progression of arthritis. If you are interested in not having a knee replacement or a joint replacement, such as a hip, the best thing for you to do is to lose weight. You're far more likely to end up with a knee or joint replacement if you're carrying too much weight. Another thing I like to talk about is sleep apnea. Sleep apnea is a condition where people stop breathing when they sleep, and it's in addition to the fact that people aren't rested, they tend to snore with this issue as well. The other issue is that because they're not oxygenating at night, it can cause heart problems and all kinds of issues like that. To improve sleep apnea, weight loss is a great way to do that. As you lose weight, you'll have less and less sleep apnea. You'll actually feel more rested in the morning, and you'll have fewer adverse health outcomes as well. Back pain. If you go to a back doctor or a primary care doctor or orthopedic surgeon and you've got back pain, they are all going to tell you that losing weight is the first thing that you should do. Losing weight helps decrease your back pain significantly. Losing weight has positive outcomes on heart health. There's two other things I wanted to mention too, and that is mood. If you take a look at mood disorders, they are all basically have a linear relationship with your weight. In other words, the heavier you are, the less likely you are to be in a good mood. The incidence of depression increases with your weight. So if you're having trouble with mood disorder or depression, a great thing to do is to lose weight.